All right, so we're gonna go over collecting urine samples. First thing you need to keep in mind is you don't have to wait for a provider to tell you to get a urine sample. Go ahead and get it right away. And this would be for patients who have any type of urinary symptoms, even things like lower abdominal pain. These can be considered urinary symptoms. So go ahead and get a urine sample and get it tested. The first thing you want to do is bring the patient out of the room, bring them to the restroom, and what you want to do is have them in their own handwriting. Go ahead and put their full name and birthday on the cup, full name and birthday on the cup, and then give them some wipes. And you have to give them some brief instructions on how to obtain a clean catch, okay? Now, on the wall at each clinic, there should be steps on how to collect a midstream or clean catch urine sample. But if you want to simplify it for the patient, just say, hey, for female patients, please use wipes, 3 wipes, front to back, and then you want to give me a clean catch in this cup, meaning you can pee a little bit and then stop and then give me a sample after. Once you're done, please cover the cup and place it into the tray, okay? For males, they can clean the tip of the penis and then give a sample straight into here. Generally in males, we want the initial stream because a lot of times that's where the pathogen or bacteria is that we're trying to find is. And so again, they would put it in here, close it off, and place it into the tray, okay? For you, what you want to do is you want to be waiting outside the restroom. As soon as they're done, you want to go ahead and take them back to the room, come back. Please make sure you have your gloves on. You want to grab the sample, and what you will do is you will bring it out here. You're going to go ahead and open it up. Get one of the test strips. Now, you may have test strips that are a little bit different at your clinics, but in general, they all, for the most part, check for the same things. The most important things on here are probably ketones, nitrites, and definitely the leukocytes. So you grab one of these strips, go ahead and put it into the urine, put it in the corner here, bend it down so all the squares are covered, pull it out, put it here, and I highly recommend you use the timer, okay? You don't want to put it on the machine immediately. You want to let it sit for a little bit. And the reason for that is the machine generally doesn't count more than 20-30 seconds or so before it gives you the read. But leukocytes need 60 to 120 seconds to get an accurate reading. So you definitely want to sit it out here for at least a minute and then put it on the machine. Once you put it on the machine, a lot of the machines will give you a readout of the results. Once you get that readout, you pull it off, go ahead and put the patient's initials, put the room number, initials, room number, and then if they're female, you want to put HCG negative or positive. HCG refers to the pregnancy test, okay? Now, as soon as you go ahead and pull the sample here for the UA, pop one of these open, put it into the urine, and pull it to the side. This, you have to wait 5 minutes on, okay? Now, one question that always comes up is, who do we run a pregnancy test on? As a general rule, it's roughly 10 to 50. That's the age. As long as they haven't had a hysterectomy or tubal ligation, go ahead and run it. Now, the question also comes in where, okay, am I really running a pregnancy test on a 10-year-old or 11, 12-year-old? I would hold off on the age between 10 and 18 if they're here with a guardian. I would let the provider figure that out. A lot of times what providers will do is they will ask the parent to leave the room for a minute and ask them more personal questions. If it's like a 15, 16, 17-year-old, ask them about their sexual history. Are they sexually active? Do they have STD concerns? Things like that. So leave that to the provider. I don't want to put you in that weird position, okay? And then finally, once you're done with all that, you give the receipt or the printout to the provider up front. And please, super important, do not toss this immediately, okay? leave it sitting here. Sometimes providers, they're a little busy, they're trying to finish their charts. And so maybe half an hour later, 45 minutes, an hour later, say, hey, so-and-so, MA, can we send out that urine sample for the patient for a culture sensitivity or STI? The last thing you want to do is tell the provider, no, I'm sorry, I tossed it, okay? So leave it sitting. And you know, if you're kind of cleaning up, keeping up with things, and you see it sitting there and it's been a couple hours, you can go ahead and go to the provider and say, hey, that one sample, do you want to send it out or do you want me to toss it? Okay. Now, if they do want to send it out, obviously you're gonna obtain a sample. And if they don't want it, please make sure this cap has a needle inside. This does not go in the garbage. This goes in a sharps container. If you have a large sharps container, please put it in there. You can, again, make sure you're gloved, toss the urine in the toilet and the cup in the garbage. In the next video, I'm gonna go over how to collect the sample. Actually, that will be more with the orchard videos of the orchard labs in terms of collecting samples, prepping them, and sending them out. Thank you.